assessing the thorax, cardiovascular, and breast. So I'm washing my hands to prevent any spread of microorganisms. So hi sir, may I ask your name?
I'm Ernesto.
So I'm Beverly. I'm a nurse. How are you?
I'm good.
Okay. So I'm going to do an assessment on your thorax, cardiovascular, and breast today. But before that, I will put the curtains down and close the door for your privacy. And also to lower the rails to prevent any risk of injuries, and also to put a blanket for your privacy and warmth. So I am going to start out by observing your respiration. So please breathe normally. Okay, so everything is normal. I do not see any abnormalities indicating diseases like apnea, tachypnea, bradypnea, hyperpnea, hypoventilation, and hyperventilation. Now I am going to move at the back. So the ratio of your lateral diameter of the thorax and the anterior-posterior diameter is 2 to 1. So everything is normal. So now I am going to palpate the venous process. So it is evenly spaced and I do not feel any tenderness. I do not see any concern like injury or any vertebral anomalies. So everything is normal. Next is I am going to assess the respiration expansion. So please take a deep, slow breath as I put my thumb on your thoracic vertebra. Okay. Again. So it is symmetrical. Now I am going to proceed on your voice sounds as you repeatedly say the phrase 99.
99, 99, 99, 99.
So each location has an equal vibration. So I did not hear any stridor, any wheezes, or any rails. So everything is normal. Now I am going to perform a midget percussion using a systematic pattern. So So I see dullness over your diaphragm, meaning resonance is equal over the lungs. So I do not feel any concern or any abnormalities like acute asthma. So everything is normal. So now I am going to assess the diaphragmatic execution. So please exhale and hold your breath as I am going to percuss the scapula downwards. Until I hear dullness. So I am going to mark this spot. Next, inhale deeply as I percuss further. And hear dullness. So I'm going to mark this spot. And now I am going to measure it. So it measures 5 centimeter and I'm going to do it on the other side. So it is equal on the other side. So everything is normal. I do not feel any abnormalities indicating hyperinflation or any diaphragmatic paralysis. Now, to assess your kidney using blunt or fist over the costovertebral angle, so I do not feel any tenderness. I do not see any abnormalities indicating kidney pain. So everything is normal. So now I am going to auscultate the breath sounds. So please take a deep breath through your mouth. So I heard some bronchovesicular sound between the scapula. And vesicular sound up is just down to the bases and laterally. So I do not hear any abnormal sounds like wheezes and cracks which causes obstruction. So now I am going to assess your anterior thorax. I'm going to assess your anterior thorax. So it is symmetrical. I do not see any retractions or bulges. Everything is normal. I do not see any result of respiratory difficulties like cyanosis or nostril flaring. Now I am going to palpate your thorax, moving from the lungs to the bases. So I do not feel any lungs. So I do not feel any tenderness. Okay, so everything is normal. Now I am going to assess your respiratory expansion. Okay, so take a deep breath. Okay, again. So it moves symmetrically, so everything is normal. Now I am going to assess for the tractile prematus. So repeatedly say 99 as I assess your lung down to below near your nipple. So there's nipple. Okay, so everything is normal. So I am going to percuss over the lungs. So So it produces a low resonant sound, so it is normal. Next, I am going to auscultate over the patient's lungs. So I did not hear any muffled or any indistinct sound. So everything is normal. There is no concern indicating hyperinflation. Now I am going to assess your cardiovascular aspect of the thorax. So please lay down on bed into a semi-Fowler's position to move at the right side. Please. So now I am going to assess the cardiovascular aspect. So I am going to check the apical pulse, inspect the fourth and fifth intercostal spaces, the midclavicular line. So the normal pulse rate is 60 beats and to 100 beats, and for the abnormal apical pulse, it is more than or above 11 bpm or beats per minute, or less than 60 bpm, so it is abnormal. So I see that there's nothing in concern, so everything is normal. So now I am going side view. I'm going to palpate your apical pulse, so gentle at the top area of 2 centimeter. Okay, front again. So now I am going to palpate your heart borders into a your heart borders. So I did not hear any waves of vibration, so everything is normal. Then I am going now to auscultate the heart close to the sternum. Okay, so everything is normal. I do not see any concern indicating chest pain or discomfort. Now, sir, you can take a seat again, for I am going to assess your breast. So now I am going to inspect your breast. So I see that one is, so both sides are equal. So, may I ask you to put your thumb a bit upward, for I am going to inspect your breast. It's okay, sir?
Yes, ma'am.
Okay, so I do not. So your breast is smooth, and I do not see any visible lymph nodes. I do not see any lesions or any redness on your breast, and I did not see any dimpling or retraction, so it is normal. Now I am going to palpate the axilla to assess the lymph nodes. So I see that lymph nodes moves freely and small, and I did not see anything of concern like lymphadenopathy, so everything is normal. Now I am going to palpate your nipple, so I am going to compress it gently, so do not feel any induration or mass. So I do not feel any induration or masses, so everything is normal. So, to document the findings, divide the breast into 4 quadrants. So, I am now going to check the particular lymph nodes by palpating the group between. Are you okay, sir? Take it. So everything is normal. So any questions, sir?
None po, ma'am.
So I am now going to put the side rails up to prevent any risk of injury. And also I'm gonna wash my hands to prevent any risk of microorganisms or spreading microorganisms. Next, I am going to document the findings and record it to the patient's chart. So that concludes our assessment on thorax, cardiovascular, and breast.